Well, good morning, everyone, and thank you so much for being here for our October Town Hall meeting. We find ourselves once again meeting virtually to keep everyone as safe and healthy as possible during the ongoing COVID-19 pandemic, and I am pleased to have this opportunity for us to come together. Though I have to say, I continue to look forward to the day when we can all meet safely in person again. These meetings are extraordinarily important for us to be able to get together, even virtually, as we work through many of the challenges that we face with the pandemic, but also the many opportunities as the Ohio State Wexner Medical Center and our health science colleges advance. What I'd like to do today is start by introducing some new appointments to Ohio State, and I'd like to start first by welcoming Dr. Carol Bradford, Dean of the College of Medicine, who officially joined us earlier this month. I'm pleased to share that Dr. Bradford is here with us today, and you're going to be hearing more from her shortly in the meeting. I also, again, want to take this opportunity to express our gratitude to Dr. Jim Rocco for his service as interim dean during a very challenging time in healthcare. I'm pleased that he will continue to remain as chair of the Department of Otolaryngology, Head and Neck Surgery. And again, I want to express my enormous gratitude to Jim for his leadership during this time. We should also take a moment to celebrate the extraordinary news that we received earlier this week from the American Nurses Credentialing Center, confirming that University Hospital, Ross Hart Hospital, the Brain and Spine Hospital, and Dodd Rehabilitation Hospital are once again being honored with the prestigious Magnet Designation, the highest award a hospital can receive for nursing excellence and quality patient care. A few things struck me from the report prepared by the ANCC after their site visit. It says, in part, during the site visit, there was patient and family-centered care, and its concepts guide all care in the organization. The appraisers observed a proactive and ongoing comprehensive, compassionate response to and in support of staff in response to the COVID-19 surge in Ohio, including twice daily briefings, providing meals, 24 hours support line, and frequent leader rounding. Without a doubt, there are strong interprofessional partnerships among all levels where care is delivered. They noted innovation permeates much of the practice in the organization. And finally, there is palpable pride among nursing staff in being a Buckeye nurse. I think this speaks volumes, and I know the phrase is often used. It's not just what we do, it is who we are, and you live every day. Well, I have to say that I am just so proud of this affirmation from the ANCC. It speaks volumes about outstanding nursing at our institution, and it speaks volumes about our staff and faculty and all the work they do. So we are enormously grateful for this wonderful report, enormously grateful to our nurses for what they've accomplished. We know that this is a difficult and challenging time in healthcare across the nation and around the world, but through it all, you continue to let the Buckeye spirit shine. Thank you. This is, I should mention, the fourth Magnet designation that we've received as an institution, and without a doubt, it is a testament to the professionalism and the passion of our nursing staff here at the Wexner Medical Center. I just want to shift gears a bit and talk a little bit about our continued focus on COVID-19 response and recovery efforts. We know that the coming months remain uncertain, and we're already reading reports from Western Europe and other countries around the world of a new upsurge in cases. We're seeing in the United States areas of the country that are seeing an upsurge as well. And as we enter the fall and winter months, we have to be prepared for the likelihood of seeing, again, similar patterns occurring here in Ohio. With that in mind, though, we know that there's a tremendous amount that we have to do going forward. The impact of this pandemic on Ohio State is significant across the university. And as I think you all know, earlier this year, the university announced a pause in the annual merit compensation process for all faculty and staff at OSU as part of a continued effort to proactively address the financial challenges across the entire Ohio State University caused by COVID-19. Undoubtedly, as one Buckeye family, we must come together to recover and weather this storm in a very challenging time, knowing that we will get to the other side. Despite these challenges, we remain committed to ensuring that our faculty and staff are supported in every way we can. We will continue to offer enhanced leave options, dependent care support, pay protections, and wellness resources throughout the pandemic, with a focus on your health and well-being. As health professionals, we all know that we're not out of the woods at this time when it comes to COVID-19. We can't get complacent. We have a responsibility as representatives of the medical center, the health science colleges, and the university to lead by example and to demonstrate the health and safety protocols that help slow the spread of the virus. And that means, first and foremost, we must wear masks at work and when we're out in public. We must be diligent about physical distancing. We have to practice good hand hygiene, and we have to avoid crowds of 10 or more, especially when indoors, because that's where we know that COVID-19 spreads more easily as droplets and as a mist. It's also particularly true right now as we move into flu season and consider what that will look like in conjunction with COVID-19. This is certainly uncharted territory, and we're optimistic and that we're well prepared for what's ahead. Our healthcare system faces some very significant challenges as a result of the influx of both flu and COVID at the same time. This year, flu shots are more important than ever. It's truly the best way to keep yourself and your family and everyone around you as safe and healthy as possible. You can get a flu shot by scheduling an appointment with Employee Health Services or through your local pharmacy or primary care provider. Clinical staff at the Wexner Medical Center may contact their unit ambassador for a flu shot. And I encourage you to visit HealthBeat Hub for more details. I also want to take a moment to acknowledge two important events. The first, the Wexner Medical Center recently hosted its 20th annual Healthy Community Day at Ohio State Outpatient Care East. It looked a little bit different this year. It was a drive-through experience to keep everybody safe. But we still were able to provide more than 350 free flu shots. We distributed 80 Narcan kits and information from our Project Dawn team. We registered voters. We gave out several hundred pounds of fresh produce, and we provided other health resources and personal care products. The event was a tremendous success, as you can see from the photos on this slide. I want to thank our faculty and staff members from the Medical Center and the Health Science Colleges who served on the Planning Committee, as well as more than 125 volunteers, including our PharmD students from the College of Pharmacy. Their collaboration, their leadership, and commitment made Healthy Community Day 2.0 a success. Last week, we also hosted the first in a new series called Roundtables on Actions Against Racism, or ROAR, as part of our anti-racism action plan. And it was, no pun intended, a roaring success. The focus of these roundtables is to elevate critical conversations about racism and engage community leaders to work collaboratively to achieve meaningful and lasting change. Led by Dr. Darrell Gray, we were joined by prominent community, business, and civic leaders, including Columbus Partnership CEO and President Alex Fisher, Columbus City Council President Shannon Hardin, Director of the Ohio State University Department of Public Safety, Monica Mole, and CEO of ADAM, Erica Clark-Jones, for an important discussion on safe spaces and safe communities. And of course, introducing ROAR is just one of the many strides being made by the Wexner Medical Center and the Health Science Colleges as part of our anti-racism initiatives here at the university. But our work is far from over. I'm incredibly proud of the progress we continue to make as we work to push forward an anti-racism movement. We've assembled a diverse group of leaders to serve on the Anti-Racism Oversight Committee with representation from across the Medical Center and the Health Science Colleges. The committee is chaired by Dr. Nwando Oliwala and Autumn Glover. This group will guide our work to ensure diversity and inclusion is integrated across all aspects of our organization, from education and training, community engagement, and patient experiences, to policies and advocacy, as well as employee engagement and communication. We've assembled 9 anti-racism action groups that will create and support strategic initiatives for implementation, and selected a cross-section of more than 140 champions who are nominated by their peers to help drive these efforts forward based on their passion, desire for change, and willingness to provide input to move our organization forward. These groups are already hard at work developing a charter and identifying key initiatives and priorities for their groups. I am so grateful to the Oversight Committee members and all of our champions who are investing their time, talent, and energy in support of these goals. Next slide. I also want to encourage all leaders joining us today to consider ways in which you can engage your teams and empower them to support our anti-racism goals. The 21-day anti-racism challenge is a great first step. It can be undertaken as an individual, a group, a unit, or a department. Participants in the challenge commit to taking on one action a day to further their understanding of power, privilege, systemic racism, and equity. And this is something I've challenged the entire leadership to participate in, and I hope you will join me in challenging your teams as well. So, as part of our anti-racism action plan priorities, we're continuing to exercise our responsibility as a trusted provider of community health and well-being to encourage participation in our nation's electoral process. As we help educate those around us and advocate for everyone in our communities to safely participate in the upcoming election, I want to remind you that early mail-in voting is already open in the state of Ohio. Please make sure your vote counts for 2020. And now, as we continue to lead the way in creating the academic health model of the future, it is so important that we work together as leaders to define our specific goals and strategies and put them into action. I'm extraordinarily excited about the work that we're doing in this area, really creating the leadership at the national and global level for what health and the health sciences should look like. So I'm pleased to turn it over to our Chief Strategy and Transformation Officer, Jennifer Dower, who will be leading us through the progress made to date on our strategic plan refresh. Jennifer?
Thank you, Dr. Paz, and good morning to everyone. I'm very excited to be with you this morning. Over the next few minutes, I want to give everyone visibility to what's going on regarding the strategic plan and our efforts to renew it. As you're probably aware, the current plan began in 2017 with strong connection and linkage to the university's overall time and change plan. If you go to the next slide, before talking about the process of renewing the plan, I wanted to take a minute with you to imagine 2 future scenarios. Imagine 2025 as we hope it will be, the kinds of things that we hope will be true, the kinds of benefits that would come to our campus and those we serve in Central Ohio and beyond. These could be benefits to our learners, our graduates, to every single one of us as employees of the team, the impact on our research, the economic benefits to the region, or breakthrough improvements in health to our community. But there is an alternate future that could arise if you go to the next slide. This is a world where we aren't so intentional, where we aren't working together as best as we could, working towards aligned goals, one that is much less optimistic, where we experience negative performance, declining volume both of patients and possibly of learners, losses in external funding, talent retention issues, and more. My intent in sharing this alternate future is not to depress you, but rather to hopefully energize you, just the opposite, as you think about the importance of our strategic plan, its goal in guiding us forward, and how each of us can be a part of it. If you go to the next slide, please. So the objective of a clear strategic plan that is understood and well implemented is to maximize the odds that we will deliver the future that we all want. The future, as Dr. Paz described, that we can create here at Ohio State, where we can be the model, where we can be a leader, really realizing the full potential of every single person in the organization. The slide that you're looking at right now is a very high-level overview of what we've been doing since we began the process in mid-August. We launched it. We've looked at external factors, what is going on within the academic health center, across the health science colleges, and what's going on, importantly, in the world around us. Probably one of the greatest changes that any of us have ever seen. In addition to looking at what we've achieved, and the external world. We're also looking at area by area to see what needs to be enhanced or evolved, or where we might need to add something to help us achieve our ambition. We're continuing this effort to engage with the broader organization, including yourselves, as well as some time with the board of directors to get everyone's input as best as we can and gain insight as we move towards preparation for fiscal 22. So if you go to the next slide, as we think about, I apologize, that's not my next slide. So hopefully everyone is aware of and familiar with the ambition that you can see in the middle of the slide to be a top 20 academic health center, driving breakthrough healthcare solutions to improve people's lives. And many would say that's a very, very big, hairy, audacious goal, something that I might call a BHAG. But if we don't have a sense of a bold, bold goal and what it will take to get there, the items that are shown in the middle of the slide, we may all get quite frustrated. We may all not know exactly how to get there. But hopefully, if we can keep that aspiration and that ambition in mind and the key drivers, we'll be able to get there together more effectively. If you go to the next slide. So as we think about the evolution of the plan, what's important is to also acknowledge what remains the same as we renew that plan. Obviously, what remains the same is our unwavering commitment to the tripartite mission, even as we also begin to look at the quadruple aim, looking at the community at large. Our values of inclusiveness, determination, empathy, sincerity, ownership, and innovation, and ultimately, and very importantly, the Buckeye spirit, that unique embodiment that defines us and enables us to do what we do exceptionally well every single day. So that's what remains the same. And as you move to the next slide, importantly, there are some elements, some driving themes that have come out of our work, elements that either we need to double down on or we need to really consider as we look to finalize the renewed plan. First and foremost is that we want to and will continue to strengthen the culture and the talent, which is a foundational element of our success. Arguably, our people are certainly, if not our most valuable asset, very, very critical in that entire scenario. Second thing, and a lot of feedback from people across the organization, in order to fully realize the strategic plan, the benefit of really making choices, of prioritizing and intentionally investing our dollars and our time as we move forward. As we do that, we will continue to deliver exceptional, high-value care and learning experiences. And I can't thank you enough for everything every single one of you do every day to help realize that reality. Obviously, we've talked a lot about the new realities that are facing us, and you can see them in the slide. Another driving theme that's come out of our work is this notion of adopting a collective mindset as a source of growth. How can we be stronger together? Why are we stronger? Because we have an amazing, amazing health system. We have an unbelievably diverse set of health science colleges, and we're fortunate to be a part of the Ohio State University. How do we take advantage of that? As we continue to drive and accelerate revenue diversification, look externally and internally at partnership developments, advance innovation, research, and commercialization efforts. And finally, we end where Dr. Paz left off, which is this notion of really evolving from a medical center to a health center and ultimately to a health platform. So if you go to the last slide, we will continue to complete our work, and hopefully you all will have an opportunity in whatever way you'd like to be involved. But I did want to just make sure that people had a sense of how you should expect to continue to be engaged in the renewal process. We're working with the marketing team right now to build out staff messaging and outreach, looking at all of the different tools so that however you communicate, we've got content for you. And importantly, as we move to finalize the plan and get ready for deployment in February, building out a leadership toolkit and a toolkit that will have information for every single person at every single level. My hope as we renew this plan is that every single one of us sees ourselves inside the plan and understands how our daily work fits in our collective overall ambition. And thank you for everything that you have done and you will do. And with that, I'll turn it back to Dr. Paz.
Thanks very much, Jennifer. Appreciate that review. Without a doubt, sometimes it's harder to make change during times of steady state. And as we work through these very tumultuous times, it only seeks to emphasize how well we are positioned for the future, given all the component parts of the health sciences here at Wexner Medical Center and this very forward-looking strategy. This is a huge opportunity for us to make an enormous difference and to continue to provide national and even global leadership for the directions that healthcare and health sciences should move to. So this plan is enormously important, and I really appreciate everybody's participation in it. Now I'm pleased to have the opportunity to introduce our new dean for the College of Medicine, Dr. Carol Bradford. Dr. Bradford joins us from that school up north, where she was the Executive Vice Dean for Academic Affairs and the Chief Academic Officer for Michigan Medicine. Please join me now in welcoming Dr. Bradford to The Ohio State University. She specializes in head and neck cancer surgery and reconstruction, cutaneous oncology, and lymph node biopsy. I've invited Dr. Bradford to join us this morning and share a little bit more about herself and her priorities for the College of Medicine. Dr. Bradford.
Thank you, Dr. Paz, for that most gracious introduction. And I can only tell all of you how privileged and honored I am to serve as your new dean of the College of Medicine and as the vice president for health sciences at Wexner Medical Center. When I think about what brought me here, it was really the tremendous transformation that I see happening at Ohio State right now. I'm truly thrilled to be part of what I see as an amazing upward trajectory that we are all on. I'm most excited about the people and the programs and our opportunity to build an outstanding future together. And we've heard about the strategic planning to support that really exciting vision for our future together. As you get to know me better, you'll learn that I'm a fierce advocate of our tripartite mission. I truly love clinical care, education, and research and discovery. And so I'm really excited about continuing to innovate the way we teach our learners with a focus on leveraging our strength in interdisciplinary collaboration with all of our health sciences colleges. Continuing the robust growth of our research portfolio and discoveries that are truly impacting lives in many diverse areas. I think we're uniquely positioned to solve unrelenting medical and healthcare challenges because we're so uniquely poised in this city of Columbus and in the state of Ohio. And we're really already on a pathway to create sustainable solutions to transform the health of our communities. We've heard about talent, and I want to tell you that recruiting, developing, and retaining the best and bright learners, staff, and faculty is critical to strengthening and developing our talent. And at the end of the day, we want to be the place where everyone feels valued and has the opportunity to thrive. I also have an unwavering commitment to diversity, equity, and inclusion for our college, medical center, as well as our community, our university, Central Ohio, and beyond. When we address these issues, we can really begin to reduce healthcare disparities and transform the well-being of our faculty, staff, and learners. Here are some of the things we're working on in the college. Our education leaders are working with students to eliminate racism and microaggressions in our curriculum. At the medical center, we're creating structural and systemic changes towards equity in health and well-being. We've heard about the anti-racism task force, and we will definitely be partnering with all those leaders to do everything we can to support that effort. So during my first few months, my top priority is listening to you, to embrace your diversity and to hear your different points of view. My listening journey will allow me to deeply understand the culture here, the Buckeye spirit that I'm already so impressed to understand, and the tremendous opportunities that we have together to develop a shared and aligned vision for the College of Medicine and Wexner Medical Center, and to really create that bold future together. I know that in partnership with all of you, we can build on our collective success and make a lasting positive impact on the communities we together serve. Next, it's my privilege to introduce Frank Ackerman, AVP for Facilities.
Well, thank you, Dr. Bradford, and good morning, everybody. It's really exciting to give you all an update this morning on our inpatient hospital and our new garage. Next slide, please. So as you can see here, on the right is the garage, and on the left is the new tower. And if you've driven in from the west side, from 315, you have seen the new garage coming out of the ground. Next slide, please. So the new garage is 50% larger than our existing north and south cannon at almost 1,900 spaces. The existing north and south are about 1,200 spaces. And the new garage will have three things that we don't have anywhere on the campus today as it relates to parking. One is on the right-hand side of this garage, the south end will be a speed ramp. So that will allow you to travel from ground level to one of the upper levels where a parking spot may be available without having to traverse the entire floor. To help you with that is a parking guidance system, much like maybe you've seen at airports around the country, that will tell you where spots are available on the floors. And then when you get on a particular floor, there are 3 lanes, and you'll be able to see where parking spots are in each lane. And last but not least, this parking garage will be Wi-Fi enabled. So that'll allow us to introduce more technology into the patient arrival experience as we move into healthcare of the future. If you look on the left-hand side of this slide here, you'll see the schedule. So we're going to close the helipad on top of North Cannon on November 13th. The project team will turn the garage over to us on November 30th. We'll activate it in the following week. And we're currently planning to open the garage on Monday, December 7th, and to close the Cannon garages on December 8th, enabling us to decommission and abate the existing garages and to begin demolition about 2 weeks later. Next slide. So with the opening of the new garage, like I said, that will allow us to begin demolition of the North and South Cannon garages, as you're shown here. Notwithstanding, we've already started work on the site, as you can see, between Cannon and the garages. And we'll see a picture later on in this presentation of all the work that's gone on in terms of prepping the site for the foundation work. But prior to doing that, we have to prepare a site to make it safe and secure for anybody who is visiting the campus. Next slide. So I want to pause on this slide a little bit, let you get your bearings. You can see where the James is, Harding just to the north, and of course the new garage down in the lower left hand. So that blue outline is really the limits of the project site, and that red polka dot in the middle is where Cannon garages are today. And so we've already set up the boundary on the north side on 12th Avenue, on the west side on Cannon, and south on 10th. What we'll talk about here on the next 3 slides is what we're doing in terms of preparing for the construction project as it impacts Harding and impacts James. All right, next slide. So you see in the upper right hand, right there beside the Harding, a red crosshatch. So that area has already been closed. We closed that on October 5th, and that will remain closed for the next 4 or 5 years. And the reason we closed it early was to allow us to do some subsurface investigation to validate the location of utilities prior to starting demolition of the north garage, which will move from east to west, from the Harding side west towards Cannon, right there adjacent in that red hashed area. Next slide. Now, if you look down in the lower right hand, right there in front of the James, when we open the new garage, that allows us then to close the existing Cannon garage entrance on Tuesday, December 8th. And then what we'll do is we'll go ahead and construct a barrier and finish constructing a pedestrian walkway. And that's that bold red line that goes from the new garage up to 10th Avenue and then up to the new James. Okay, next slide. All right. Now here is a shot from the chiller plant, the NG chiller plant, showing the work that's underway today. Now this is about a week old, so they've actually made quite a bit of progress. As you can see, they're dewatering right there in the middle. They're excavating the site down to the appropriate depth to begin drilling for caissons for the foundation. And then up north there on the bottom of the slide, you see a truck working with hydro excavation. And what they're doing is they're checking for underground utilities there prior to putting in an earth retention system. Next slide. All right, so that earth retention system, as we put that up, we actually begin tomorrow. So this is important. So tomorrow, the 16th, there will be a change in traffic patterns along the project site. As you can see here, the green line there is the ultimate fence line. So we're going to move that fence out to the street right there at the corner. We'll close the 2 crosswalks across Cannon and 12th, and then we'll put a cone and close off that lane closest to the fence to provide a safety barrier while they're doing the earth retention system. And then that'll go through about the end of the first week of November. Next slide. Long term, we'll have to set up a logistics operation in the right-hand lane of the northbound Cannon. So you can see the barrier there, and that will be there for the most of the project to allow them to deliver steel and concrete, et cetera, to the project site, and the tower cranes will pick that off and swing it around and put it on the project site. Okay, next slide. So a lot's going to be going on. A lot of things are going to be changing. So I encourage you to keep track by watching these various medium channels here, and lots going to be happening in the next couple of months, and we look forward to keeping you updated. Thank you very much, and I'd like to reintroduce Dr. Paz.
Thank you, Frank. Appreciate the update on the tower. You know, putting it in the larger context, it's extraordinary. We're not just building the largest hospital tower in the nation at the present time. 3 very large ambulatory care buildings in New Albany, in Dublin, on West Campus, and also on West Campus, our new interdisciplinary research building, and of course, our interdisciplinary health science building here on campus. We just completed work, or nearly completing work, in the College of Optometry and the College of Dentistry. So enormous progress, speaks volumes about our future as an institution, and we're very, very excited about having these state-of-the-art facilities for our students, for our faculty, and our staff. As you know, at every one of these town halls, we set aside time for questions and answers, and I'd like to do the same now. Just so you know, I've asked the following individuals to join us. You've already heard from Frank and of course, Dr. Bradford. I've asked Jackie Buck, Jennifer Dower, Amy Fairchild, Autumn Glover, Chris Kipp, David McQuaid, Allison Mincy, Phyllis Teeter, and Dr. Andy Thomas to join us. So with that, submit your questions, please. We have roughly 25 minutes for questions and then, of course, answers to your questions. So with that, why don't we get started? Okay, so our first question is, thank you for the update on anti-racism efforts and action groups. How can I get involved in this work? And with that, let me just turn it over to Autumn Glover.
Good morning. Thank you so much for your interest. As Dr. Paz noted earlier, there are 9 action groups that are tackling a variety of topics. If you're interested, believe it or not, feel free to send me or Dr. Olayiwola an email and we'll get you connected to the right action group. So there's still time to engage in this work. And while we have 140 people engaged, we certainly welcome more people to join us.
Thank you, Autumn. The next question is, can you provide an update on Workday and its timing? Phyllis, maybe you could speak to that. Phyllis Teeter.
Yes, thank you, Dr. Paz. Workday is a replacement for many of our administrative systems, including e-leave, e-request, e-travel, employee self-service, position control, e-materials, and many smaller systems. One important note is that it will not replace Kronos for the health system for our leave and timekeeping. As for dates, the system itself goes live in January. On January 3rd, the HR system goes live. Finance goes live on January 7th. And then student, which is a module that's farther out in the future, is looking to be sometime in 2023. There is training required for some roles, and there's really 3 roles. One for all staff, They need to understand their functions to maintain their address, to be able to check on their leave balances, to be able to do all the things that we all do, including myself with the HR system primarily. And then managers will have roles where they need much more training because they will be approving requests, approving HR requests, generating new postings, those kind of things. But then the core areas need training to be able to do that, which is HR, supply chain, and finance. Need extensive training, of course, to do their jobs because they'll be spending their entire day in the system. Thank you.
Thanks, Phyllis. So we have two questions. They're somewhat related. First is and Frank, pay attention, where will our backup helipad be once Cannon Garage closes? And also, the other question that came to me is, we are a major referral center for trauma, STEMI, stroke, and other time-critical diseases. Will we have more than one helipad with the new tower? And how will we address the need to have access to helicopter transports for patients being referred here?
Okay, so I'll ask Andy to jump in on the operational model, but during the project, we will have a backup helipad will be in that mall south of the James. And so we're working with EMS and security and others to have that in case the helipad that is on top of UH becomes fouled for whatever reason during the life of the project. Once the new tower is open, we'll actually have two helipads, one on top of UH as well as one on top of the new tower. But the primary pad will remain on top of UH. Andy, would you want to weigh in on the operating model for trauma?
Frank, you're exactly right about the helipads. We actually had a really good meeting with our trauma leadership a couple of weeks ago and walked through this. One thing I will emphasize, though, it's important for people to remember, we actually have a helipad at East as well. So as we look at having a stroke program there, a STEMI program there, and a trauma program there, that is also not just a backup, but really a primary location where we need to be used to taking patients from outside hospitals. But Frank's exactly right. We're going to be using the Jones Legacy Park. There's some final planning that's going to be done between now and when the helipad on the Cannon Garage is closed in November. But we believe if something were to happen to the Rhodes helipad in the interim during construction, we would be able to use that in a relatively quick time frame. It's a very wide open space. It's actually been looked at by a number of our folks who work in this area and feel that would be a good option for us. It's right across from the emergency department as well.
Thank you. Next question. As COVID continues, will work from home continue to be an option for some of our staff? So Allison, do you want to address this?
Sure, thank you, and good morning, everyone. We've talked about this before. Remote work will certainly be part of our future, and perhaps many ways that we didn't think were possible before. Importantly for us, though, a large portion of our workforce obviously is needed on site due to the clinical nature of our operations. That said, for those other areas, we are not going to dictate, if you will, centrally. We are going to trust local leaders and managers, if you will, to specify the time frame to come back to the physical workplace, again or not. Again, this is something that is going to be, evolving over time, and it will be part of our future.
Thank you. While I have you, we received a question from someone in the audience. And maybe you can answer this. If not, we'll follow up. But can you talk about taxes that are not being taken out of paychecks and what will happen in 2021 regarding the temporary tax break? If you know off the top of your head, great. Mark Larimore could not be with us this morning, so I would otherwise turn it over to him. But do you have any insight on that, Allison?
I do, actually. So we did have the option as an employer to take advantage of the tax break that has largely to do with Social Security benefits and deductions and withholding for Social Security taxes. As an entity of the state and a contributor to the public employers retirement system, it wasn't something that was enormously beneficial to our workforce. Certainly, I'm happy to follow up to provide more information. You can contact me directly, and I'm, again, happy and invite you to do that.
Thanks, Allison. So next question, Amy Fairchild. Is student COVID testing working to keep cases down on campus? And should we expect a rise as flu season begins?
Oh, thanks, Hal, and thank you for that question. Yes, but I would say it's not just testing that's keeping cases down on campus. It's all of those layers. It's testing, isolation, quarantine, contact tracing, because you can test everybody in the world, but if you don't have the procedures in place to take them out of those settings where they can infect other people, then we haven't done much. So that's just one of the things I'd underscore. It's all of those pieces. And right now in our population living on campus, our rates are down pretty close to zero. We're at the point where, we're bumping up and down under 0.5% positivity, which is quite low. Even though we have seen the rates begin to rise in Franklin County and in Columbus and the state and the nation, OSU continues to be this semi-perfect little city within a broader city and a broader community. And we're thinking too, not only about the cases on campus, the cases off campus, and those rates have come way down too, even though we don't have quite as broad a testing program there, but also the community that we live in. So one of the things that the comprehensive monitoring team does that I'm part of is look at the surrounding neighborhoods as well. So we are, of course, concerned about cold and flu season. We're concerned about the ways in which people spending more time indoors could affect cases on campus, and it's something that we look at on a daily basis.
Thank you. I appreciate that. And do you have any comment about the report that came out this week on childcare centers and the low level of infectivity among very young kids, or do you need some time to review that study?
I need some time to review that, and in part because it's a slightly different population than what we deal with. So we deal with the age groups, roughly 17 and above. I haven't taken an extensive look at that yet, but thank you, Hal. I will.
Thank you. And then the next question is for Phyllis. What's the timeline to get Office 365 enabled to medical center faculty and staff?
We do have some pilot areas that have full access to 365 and are finalized some system settings and some testing to make sure that we understand how that will work. So we are underway. We don't have an exact date, but it should be sometime within the next few weeks to a month.
Thank you. Autumn, what is the OSU Wexner Medical Center doing proactively to make access to healthcare easier for some of our low-income neighborhoods in the community?
Good morning. I think that's a great question. We have a lot of initiatives, and certainly Dr. Thomas can chime in on this as well, but we have a lot of initiatives that are based in some of our low and moderate incomes. Obviously, one is largely surrounding East Hospital and Outpatient Care East. Earlier this year, prior to COVID, we actually launched the Community Care Coach, which is a mobile primary care unit on wheels. That's just one initiative that we're doing, but all of our work, I think, and our initiatives are really focused on collaborating with the community. So really understanding what their needs are and their barriers to care. And the final one that I would note too is Total Health and Wellness Clinic has continued to serve patients in the East community and surrounding areas as well. So
thank you. Thank you very much. Andy Thomas, will we continue to run the COVID screening stations at Ackerman and East Hospital through the winter?
Thanks, Hal, for the question. At East, the current plan is to remain at East Hospital in the location they are. We're doing some winterizing for the staff there. But actually, we'll be moving the Ackerman Road location in conjunction with Columbus Public Health and the Mount Carmel Medical Center over actually to the fairgrounds, the state fairgrounds, I believe in 2 weeks. The testing for Columbus Public Health will actually move there about a week earlier. So our staff do Columbus Public Health testing 2 days a week. So we'll have a chance to test drive that space. And then we'll be moving the rest of our Ackerman operation there later in November, I guess the first week of November. So there'll be announcements that'll come out on the timing of those changes, but it is an indoor location where there will be much more protection for staff that work at the swab site on the inclement weather, but still the individual getting tested does not have to get out of their car. We'll actually be driving the car through a large event center Once again, it'll be side by side with Columbus Public Health and Mount Carmel Medical Center.
Great, thank you. Will the hiring freeze end soon? David McQuaid, do you want to talk about that? You might be on mute.
Yes. So the question now is around the hiring.
Correct.
Yeah. Carefully looking at all of our operating units and business units. We do that on a regular basis. It's critically important to us. We have a process where we review each unit. We're in the process of hiring all critical bedside personnel, which is critically important to us. So it's ongoing. We're judicious in managing it to our volume and to the needs, but we feel pretty confident that the positions that we need to hire are getting hired.
Thank you. And on a related note, there's a question regarding merit and our financial situation and the bonus. And so let me just discuss that for a minute myself. It, without a doubt, as our financial situation reflected at the end of the year, we did end the year strong, and I'm enormously proud of everyone's hard work to get us there. That is not the case at many other academic health centers around the nation, without a doubt. And we continue to hear, even of this week, as a number of peer institutions are eliminating jobs, cutting salaries, and dealing with some really difficult financial situations. We saw that throughout the pandemic. And I am just so proud of the fact that I speak now specifically about the Wexner Medical Center. That is not a situation that we found ourselves in. At the same time, I'm enormously proud that we are part of one university, the Ohio State University. And there have been, without a doubt, fiscal challenges that our entire university has had to address and has addressed successfully. But part of that decision was around not having a merit this year because of all the financial uncertainty. And that's something that we understand is an important part of being a Buckeye here at Ohio State. At the same time, we are enormously grateful for all the hard work of our frontline staff during this pandemic, and that's why we felt it was very important that we did have a bonus this year to reflect to our staff our appreciation for their work during the pandemic. We're looking at a fall and a winter, which offers tremendous uncertainty. We've continued to weather this storm really well, as you heard. But at the same time, we don't know what the next several months will bring. We don't know what things will look like in January and February. Frankly, nobody does. It's hard to predict what the situation will be with CARES funding, which was really important to us last year to close the budget on June 30th in the black and successfully. We don't know if there'll be CARES funding going forward as there was before. We don't know what the impact is going to be if there is a significant upsurge in positive cases across the nation, but in Ohio and in this region. So as you heard from David, we're going to be really outstanding stewards of our resources. We're going to be careful with how we manage our budget, but at the same time, we're going to do everything we can to support our faculty and staff and to be very clear that we are enormously appreciative of everyone's hard work that got us to where we are during these very difficult times. And we're going to remain committed to those values because I think it is exceptionally important that we do so. Next question. Can you tell us a little bit about the new hospital and the services it will include? So, David, I can toss that back to you if you'd like, and you can maybe ask a couple of your colleagues to also answer that question.
Yeah, thanks, Hal. So obviously, so many, literally more than 1,000 employees, faculty, and staff have been involved in the planning of this for more than 2.5 years, but certainly up to 820 beds in private rooms, replacing and expanding on the 440 beds in Rhodes and Doane. 60 neonatal intensive care unit bassinets. Of course, the building is 24 floors. Emergency department, imaging suites, operating rooms, critical care, med-surg units. It also plans for an indoor cafe, conservatory garden, outdoor park areas. There'll be conference facilities. Of course, all of our major service lines are incorporated into the building. The building itself is glass and brick structure designed really to maximize light in the patient rooms, which is great to improve outcomes. And as we've been stating, it's planned to open in 2026. Andy, you might comment. We've had a lot of frontline faculty and nurses involved, and maybe mention a couple of programs.
Sure. Thank you, David. A couple of things just to add to what David's already mentioned. One of the benefits, unlike with Doane and Rhodes, we had very significant limitations on floor-to-ceiling height in Doane and Rhodes that only allow it to connect into the new James on certain floors. One of the benefits of this building with the way the James was constructed is we'll be able to tie in on each floor of the building. So there'll be a lot more continuity and ability to work together. The ICU floors on 10, 11, and 12 will continue on and be ICU floors in the new tower. We'll also have our neurology and stroke, essentially the neurology and neurosurgery portions of the Brain and Spine Hospital will move to the new tower and will have its own floor with embedded neuro ICU right on the same floor, which is a huge benefit. Our transplant program will move into the new tower, as well as our trauma program, burn program, and then a lot of kind of step down from critical care that will end up in the new tower. David's already mentioned the women and infant program. That's a huge step up from the current facilities that we have that when you compare to other facilities in the city have been behind the times now for a while. So we're very bullish on the patient experience portion of the new tower, but also the staff experience portion. We've had people working in a building that was built in the 1940s and 50s. And as we all know, that's getting more and more difficult every year. So a couple of other notes. Brain and Spine Hospital will most likely get a new name, since brain and spine work won't be done there anymore, but there will still be general medicine patients most likely will be what will remain behind in the beds on the 7th, 8th, 9th, and 10th floors in what is today the 300 West 10th or Brain and Spine Hospital building. And then really a lot of other support areas, so pharmacy, lab, imaging, certainly some of the operating rooms will remain in Rhodes, where we'll use that space to really support both the Brain and Spine Hospital in its new incarnation, as well as the Ross, as well as the James and the new hospital tower. So I think just a lot of positives between new ORs, new interventional radiology. We could go on for a long time, Hal, on those issues. But
yes, thank you, Andy. So we have one last question. You've talked a lot about telehealth growth during COVID. So will we continue to see telehealth use in the future at high levels? So I truly believe we will. Certainly, in part, it has to do with how insurance companies cover telehealth, and I am going to remain hopeful that they appreciate the important benefit that telehealth offers. I also believe that patients, as they get more and more used to telehealth, are going to want to have it. And for us, this is a huge opportunity. And if you think about it, we're really building concentric circles, starting out with 7 extraordinary hospitals here at the Wexner Medical Center, our ambulatory care clinics, and as I mentioned earlier, we're building 3 more of them, some huge facilities, over 250,000 square feet, which are underway. And that will more and more be there for doing care that was previously done in a hospital setting, but also offering different types of specialty services and offering interventional radiology, surgical services as well. And the next circle around that is getting more and more into the community. So We do that now with primary care, and we're going to have more and more primary care, which is one of the reasons we announced our partnership with OneMed. But our departments of family medicine, our divisions of general internal medicine have enormous opportunities ahead of them. But we also know that patients are going to expect to be able to have access to telehealth services as well as digital services, because I think that much like every other sector of the economy, that we've become accustomed to using our phones to have access to things. There'll be the same set of expectations that our patients will have in the future. Our millennials will have increasing need for healthcare, and it's going to be very difficult to explain to them that healthcare services will be dealt with differently than every other part of their lives. Transportation, banking, retail. They're not going to be patient to be told that they need to travel an hour to go around a multi-deck parking lot to sit in an exam room waiting for a visit when they know they can have the same service provided over their iPad or their iPhone or their computer. That doesn't mean we stop doing all the things that we do in outpatient settings or in the hospital. Those are not going to go away, but it does offer us a chance to care for more and more patients and to do it seamlessly and to drive care in the home and into the local community. I think there's going to be an increasing role for mobile vans as well, and I'm very proud of the mobile vans we currently have, particularly how they've reached into underserved communities during the pandemic to address health disparities. There's going to be enormous progress there too. And as we go forward, this really gives us a chance to create this health platform of the future that you've heard about, moving from a hospital to a health system to a health platform that is both bricks and mortar and virtual. That's the enormous promise for our university. And if we do this well, that becomes the platform to educate all the students in those 7 colleges of the health sciences, 10,000 students on this campus at any given time in the health sciences that will have greater chances to have interprofessional education, being educated in teams in these new ways for care delivery. I see that we're running out of time, so let me just end by wrapping up and again telling you how grateful I am to all of you for your enormous hard work and for everything that you do. I'm enormously impressed by what we accomplish together every day. Everyone working on the front line, everyone working behind the scenes to create the enormous success across all of our mission areas at The Ohio State University, the Wexner Medical Center, and our health science colleges. Thank you for all you do, and have a great day.